All right, well, welcome and good afternoon to the Coit College of Pharmacy here at the University of Arizona. And so pleased to see all of you here. I'm Ted Tong, and I'm one of the faculty members here at the College of Pharmacy, and I have the honor to welcome home a family member. All right, so, where do you begin? Except that we've missed you, and we're very, very honored and happy this afternoon to welcome back Dr. Marie Chisholm-Burns. All right. And for the people who haven't met Marie, I'm going to take a few seconds and mention a few things. But Dr. Marie Chisholm-Burns is the Executive Vice President and Provost of the Oregon Health Science University in Portland, Oregon. Now, a little background with Marie. Marie is a child of the East Coast, went to the University of Georgia, where she earned her pharmacy degree, her Bachelor of Science, and also her PharmD from the University of Georgia. She stayed on and did residencies and became a faculty member at the University of Georgia, and really became part of the university family, University of Arizona family, about 2002, 2003, if I'm about the time that she arrived here. Marie arrived here at the University of Arizona and was appointed a professor of pharmacy practice and science, and also chair of the Department of Pharmacy Practice and Science. And a very, very phenomenal, about 10 years that she was here, because as I was, and you will know, every award for teaching, for research, for leadership offered by the American College of Clinical Pharmacy, the American Association or Academy of Pharmacy Education, the American Pharmacists Association, and also the American Society of Hospital Pharmacy, have been awards that Marie have received. And it was for her tremendous work in very many areas, research, where she received many actually NIH type grants, millions of dollars in the area of transplant patients and the clinical application and care of transplant patients. But she was also very, very active in many other areas, particularly in teaching and research. And particularly here at the University of Arizona. And as I look out here, I want to recognize, and I know Marita, Provost Emeritus George Davis. Dr. Davis is here, all right? And it's the Provost University. He was Marie's mentor and had tremendous contributions, the two of them, in the area of the university's diversity and recruitment and inclusion and equity, and all those things are very important. But Marie was also very much involved in other things. While she was department head and professor and had a full teaching load, research, bringing in all the NIH money, she was also involved in scholarly activity and published a book with our vice president for human resources at the time, Dr. Allison Valancourt. And so a book was on research, but actually was on leadership and management in a research university, which was very appropriate for now in her position as a provost at a major medical center here at the University of Oregon. So Marie, welcome back home, and we're glad that you're here. Thank you for being here.
Thank you. It is good to be back home, and I'm so thankful for everyone. I want to thank you, Ted, for that great introduction. I want to thank my good friend Mike for the collection of balls I have about, I don't know, almost three. Gosh, I bet you I have about 36 of them because I kept them all. They're good for squeezing, and we could talk about that story a little bit later. My presentation is not going to go terribly long because I want to give us the opportunity to chit chat, to catch up. I see a lot of friends in the audience, and friends from before, continuing friends, but I also see a lot of new faces that I want to get to learn as well. It's always good to be back home. I'm so glad, Dr. Tung, that you allowed me to come back and be here. And I'm so honored to speak with you today about building bridges. Now, before I begin my presentation, I bring you greetings from John and Little John. Now, this is when we were here in Tucson, and so, time hit me as well. And I could say, in this picture, I think we did a sneak trip over to Vegas to go to the aquarium. But this is us now. And as you can see, little John is not so little anymore. He's 6'4", I believe, and growing. And he's trying to figure out what he wants to do with his life. At the same time, I'm trying to figure out how to get him off of my payroll. And the one thing that I keep on reminding him of is to follow his passion. And this is the one key message. If you don't walk away with anything else today, I want to leave you with following your passion. Nelson Mandela once said that there's no passion to be found playing small and settling for a life that is less than the one that you are capable of living. Today, I will share with you some of the passions that guided my career journey, including making a difference and building bridges in health professions, education, and healthcare. So just to keep me on track, and you might be thinking, okay, how long is she going to be up there exactly? I promised, I timed this talk within 25 minutes. I'm done, right? And we can talk about other things. You'll have enough of me within 25 minutes. But I want to hit some key objectives. I want to give you a little bit about my background and experience. Dr. Tong did a wonderful job. And I want to thank many of you that's in here today. We have had continuous relationships throughout the years. You email me, you tell me all the good restaurants that have come and gone, and I really appreciate hearing about all of that. I know Helena, who's the vice president and chief HR officer now. We did it monthly, but then it looks like we get busy, and now it's quarterly. The vacation came in December, and I think we got to get that back on the schedule again. But I have so many colleagues here that I think about so often. And when I get to the health disparities, you're going to be on, and it's going to be a blast from the past, and you can link it to the age of your child, because we're going back. But so many wonderful relationships that I have here that I want to continue on. Then I'm going to talk to you a little bit about Oregon Health and Science University. I'm going to say OHSU because it is truly a mouthful to say all those words. Dr. Tong asked me to spend a little bit of time on that, and I'll do so, and I'll talk about some of the similarities that we have here that at least that I remember from the University of Arizona. Although I was a little surprised as I was looking around, I said, I didn't park that far away when I came into the building. And so there's a building on my parking lot now, which I'm sure you needed the space, but it's now, if I had to park, I have to park a little bit further, which is all good. So with that being said, I'm going to move into discuss health disparities and health equity. As I said, Elizabeth, wait for your cue is going to come up soon. And throughout my talk, I'm going to emphasize the importance of building bridges. Now, first, let me start with a little background and experience. Dr. Tung did a great job of walking through this, but I'll give you the icons. I began my career as a faculty member at the University of Georgia College of Pharmacy. I guess we can talk sports. Y'all messed up my bracket once again. With basketball, but that's okay. But we have to honor the University of Georgia for SEC football 2 years in a row. I rose through the ranks from assistant professor to associate professor with tenure and to full professor at the University of Georgia. Was there about 13 years. And while at Georgia, I founded the Medication Access Program, or MAP, which I'm still director of today. It's so important to, once you build those bridges, is to stay connected. And so I have a deep relationship with the University of Georgia that continues today. I'll tell you a little bit about MAP a little later, but in terms of my professional journey, MAP was foundational to my interest in other leadership opportunities. Now, after 13 years of being at UGA, I was recruited to come here to become department head of pharmacy practice and science here at the University of Arizona College of Pharmacy. And both of the individuals that you talked, Dr. Tung, you're right, Dr. Davis, he was instrumental. But I remember when you called me and you said, Marie, what's the challenges? What's the barriers? What's going through your head? He was the provost. And just to get that, I went back and I'm like, am I going to Arizona? No, probably not going to Arizona. And got that phone call. And Ted kept in touch with me. And really, it was that relationship and those promises kept, I have to say, that keeps all of us connected. So thank you very much to both of you for what you have done. And really coming to the University of Arizona was a game changer for me. Lots of awesome relationships. I remember, Helena, was you a graduate student at that time? Or you were just getting out? You were with Allison Valancourt, but Raji, you were also with Raji working. And so we spent a lot of time working on women's things for advancement of women's things with Leslie Talbert. God, I'm going back, right? This is a throwback from the past, but had lots of great opportunities. And again, I want to thank you for that. So I was here at the University of Arizona as department head, and then I was recruited to become dean and distinguished professor at the University of Tennessee Health Science Center College of Pharmacy. Now, at the University of Tennessee, I was the first African American and first woman dean among 8 deans in the college's history. The college at that time, it's a long history college, around 120 years old. And I served in that role for more than a decade. Last year, I was recruited to become executive vice president and provost of Oregon Health and Science University in Portland, Oregon. Now, just like the University of Tennessee, just like Arizona, it's a long-standing university. It's over 100 years old. It was first named University of Oregon Medical Department. The institution went through several name changes, and in 2001, it became Oregon Health and Science University. And over the past 40 plus years, they have had 6 chief academic officers and provosts. I'm the 6th one. Now, Dr. Tung also talked to you about when I was a clinician, a transplant pharmacist. So I spent a lot of years in healthcare. And so healthcare is very dear to me. And this job gives me that intersection of healthcare, and you'll learn a little bit more about that, as well as academics. But one of the things that I wanted to achieve in healthcare was to get my FACHE. And you might be saying, Marie, what in the world does FACHE signify? Well, it's the Fellow in the American College of Healthcare Executives. And it's a credential that signifies achievement of a high level of leadership and competency in healthcare management. And so passing this national board exam, and I thought the NAPLEX was hard and tedious. This was 6 hours long. And I did this earlier this year, and I'm not getting any younger. So, after saying, several prayers throughout the exam, I was saying, man, why am I doing this? Why am I putting my body through this? But it had a good ending, and that was good because I don't know if I was going to take this again. So I used about 5 hours and 50 minutes because I'm one of these people that, it was electronic tests, and hey, if I submit it, suppose I get glitches. So I wanted to give myself 10 minutes to work that out. But all worked out very well. And receiving this was extremely rewarding for me. Now, healthcare and healthcare education are closely associated. Many of you teach in the pharmacy program. But let me just focus on the education part of this equation for a few minutes. I firmly believe that education is the gateway to the future. And one of my guiding passions has been to prepare new generations of students for tomorrow's world. And the opportunity to serve as executive vice president and provost represents a broad platform for living this passion. Now, you might be asking yourself, some of you, hey, Marie, what exactly does a provost do? I don't know if you used to get that question. They know what a dean does, they know what a department head does, but it's like, what does a provost do? Especially to students, right? Like, what is that, right? And so I try to sum it up like this. And I don't know if when you were asked that question, Dr. Davis, what did you say? But I say it's a bridge builder. It's a bridge builder for success for all of our students, for our faculty, for our staff, and the communities we serve. More specifically, I started working on this slide and then I got tired and the fonts kept on getting smaller and smaller and I kept squinching and I said, you know what, just sum it up. You do a lot of different things, right? But it's not really me, it's we, the team. We do a lot of different things. The Provost's office oversees the academic mission of the university and it has lots of direct reports. And I'm really going to be feeling that when I do the evaluations next month. But all of the schools, colleges, academic programs, in collaborations with the deans and the directors, report up to the provost's offices, the Office of Student Affairs, Faculty Affairs, Academic Affairs, for the students in the audience, the registrar's office. Those are the people when you get ready to graduate, they're checking off to make sure you got the courses right so you can graduate. So it will become increasingly more important to you as you reach graduation. Financial aid is important right now, so I know you know the financial aid office. Assessment reports up to the provost, the libraries, simulations, interprofessional education. In Oregon, other than Portland, maybe Eugene and Corvallis, the rest of the cities in Portland, Bend is a growing, that's central Oregon. Rest of the cities, I should say, in Oregon are relatively small. And so we have a large rural health program. And so we have to find placement for our students as well as a place for them to live in housing. Different than many provost jobs, Oregon's area health education centers and rural health report to the provost office in the state of Oregon and the campus for rural health. So that's a little sidebar that's not usual for most provost offices. And then we have many centers like the Center for Diversity and Inclusion and the Center for Ethics in Healthcare. I got tired. I needed to move on to the next slide, so I just summed it up. Could keep on going, but a lot of different things. You get it. It's a very broad job. Now that I told you a little bit about the various aspects of my work at OHSU, let me tell you about the university itself. OHSU is Oregon's only public academic health center. For those of you, when I was here, you probably said, I worry about Marie. She works a little too hard and she needs some outlets. I paint now. I'm not saying that I'm good, but this is what I do. And so I painted this just for you so I could take a picture of it and put it on this slide. So this is the logo of OHSU, and it really is a flame. And the flame has 3 colors that you see. So we're an institution of higher learning with several schools, a health system, and a national research hub. Again, the logo is the flame, and with its 3 colors, it represents our 3 themes. Our motto at OHSU is where healing, teaching, and discovery come together, as you will see in this video.
We come from places near and far away. Nurses, doctors, learners, researchers, and caretakers. We're here in this land of volcanoes, striped with rivers and thick with forests, to learn, to discover, to heal. We acknowledge those who came before us and all the people we left behind. Together, we can accomplish so much more, because it's been our mission from the start to bring health and hope to all of humanity, to work toward a cause that's bigger than any of us, and to never stop bending toward the light.
So in this video, you've seen several areas that I'm going to sort of tap upon in the next few minutes. OHSU has really 4 schools and 1 college. We have a school of dentistry, a school of medicine, a school of nursing, a school of public health, and a college of pharmacy. Now, the School of Public Health is in partnership with Portland State University. You may have heard of Portland State University is located downtown Portland. It has roughly 22,000 students. Most of the students are undergrad. I think around 17,000 or so are graduate students. Portland State is unique as it's going to become. I think it actually reached this merit already, this recognition. Most of its students are underserved minority students, and so it's a majority minority university. And the College of Pharmacy is in partnership with Oregon State University. Oregon State University is located in Corvallis, Oregon. It's about an hour and a half, or within an hour and a half south of Portland. It has roughly 35,000 students. Again, large undergraduate population, around 30,000. Now, in this picture, and let's see if I could do this, and I don't know if the people in Phoenix could see this, but for those of you who could see, I guess this pointer is working. This is a picture of Markham Hill, and I could talk about that. This is where our campus is located in Portland. So if those of you who've been to Portland, it's a very hilly city, right? Just look up at one of the largest hills. And don't look toward Mount Hood. That's another story, okay? But right there in Portland, and you see a bunch of buildings on a hill, that's Markham Hill. Now, we could talk about whose bright idea was it to put the hospitals on the hill. Again, another story. But right here is the hospital, okay? Right here is a big library complex. So this is adults in this hospital. There's an ER that the adult hospital and our children's hospitals share. But if you go across this bridge, that's where you get to Dornbecker. That's our children's hospital. You go down the hill a little bit, you get Shriners Hospital over here. Outside of this picture, but over in this direction, you have the VA hospital. So you get the point. There's a lot of hospitals, lots of clinics over here, administration buildings. So the building that I'm located in will be over here. And back in here, you have the nursing school. Now, that's the Markham Hill campus. It's commonly referred to as Pill Hill. Whole nother story. We could get there if you want to. Now, because it's so hilly in Portland, a lot of times you walk from ground level and you think, I'm on the first floor. That would be a good assumption to make, right? Not so there. You're on the 9th floor of the hospital when you walk in our hospital. And what you see if you go west and maneuver your way through the hospital on the 9th floor, ground level, now you can really see how far up you are here. You could catch a tram, sort of like what you would do at Disney World, right? You catch a tram, 5-minute tram, and it will get you to our south waterfront of campus. Now you're going over the interstate, going over some nice people's houses and things of that nature. But within 5 minutes, instead of 30 minutes, because that's probably what it would take you to get in your car, drive down there, find a parking space. Now, parking's a whole nother story on that hill, but we could talk about that later too. And probably one of the provost's biggest problems, okay? But I can't help that we're on a hill, and that's what I tell people. So with that, you could go 5 minutes down, South Waterfront, on our South Waterfront campus. That's where we have most of our outpatient clinics, and it's a slew of them. So our Night Cancer Center is down there that specializes in all sorts of different types of cancer, and we could talk about that, everything from multiple myeloma to Brian Drucker is the head of the Night Center, and he's the guy who developed one of the major therapies for leukemia. So that's the dental school right there, and where we have our dental clinics, and we also have some classrooms on our South Waterfront campus. We also have a statewide presence as our educational research, healthcare, and community outreach extends across Oregon. Now, the state of Oregon is rather large, is greater than 98,000 square miles with approximately 4.3 million people. So it's not a lot of people, but it's a lot of land. Our School of Nursing has 5 campuses. They're circled, the cities are circled in red on this map. And then our campus for rural health has 3 locations around the state. They're circled in blue. Across our campuses, we have more than 4,200 students enrolled in greater than 55 degree or certificate programs. And this includes our joint programs with Portland State University, Oregon State University, and Oregon Institute of Technology. We have approximately 3,300 faculty providing educational programming to our students, but we have more than 19,000 employees. So many of our employees don't have appointments. Some of them do, and many of them stem from the medical school as well as the School of Nursing. And so, again, lots of different people, different types of people, and a very large, complex organization. So I'm going to put on my executive vice president hat, and I'm going to talk a little bit about healthcare to you. In fiscal year 2022, and we're on the same fiscal year as Arizona is, July to June, we served more than 328,000 patients through hospital admissions and medical clinics, as well as more than 12,000 patients in dental clinics. And in terms of patient visits, we had more than 1 million patient clinic visits, and more than 50,000 emergency department visits, and more than 57,000 dental clinic visits alone in fiscal year 2022. In terms of research, I can't have this talk without talking about research. I'm going to use the federal fiscal year because I didn't feel like working the numbers over again, to be honest with you. But we were awarded greater than $289 million in NIH funding, and that's a large amount of funding. Our medical school ranks 29th in the country in terms of funding. And our total research for fiscal year 2022 exceeds over $500 million a year. Now, I talked to you a little bit earlier about my husband, and I love all of our centers. Don't get me wrong, that we have at the university, at our university. But I'm going to talk to you a little bit about the Primate Center. That's where my husband John works. It's at our West Campus, which is probably, I don't know, 10 minutes outside of the greater Portland area. So the Oregon National Primate Research Center, again, OHSU center, was founded in 1962. In fact, it was the first primate center in the country. Now it's one of 7 national primate research centers in the United States. And all of these centers are funded by several different resources, including NIH. Our center here is the home of approximately 5,000 non-human primates. And if any of you are in town, if you give me heads up, I could have it arranged where you could have a field trip out at the center and you could see this center. It's just amazing how these primates live. Most of them, I learned a lot about primates in the last 6 months. So let me get this right. Macaque rhesus. And there's a difference, okay? And the primates have a social structure, and they eat monkey chow. That's what my husband tells me, and I hear a lot about the Primate Center when I come home each day. Now they have 5 areas that they do most of their research on: cardiometabolic health, neuroscience, pathobiology and immunology, reproductive and developmental sciences, and genetics. Now I'm going to pivot a little bit, okay? And I'm going to talk to you about one of my personal passions that intersects my work as a healthcare professional, a researcher, and an academic leader. And this is my passion for pursuing solutions to health disparities and opportunities to build bridges to health equity. In 1966, Dr. Martin Luther King Jr. stated, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhuman." And here we are, almost 60 years later, we are still confronted with the challenge of eliminating health and healthcare disparities that affect populations who are historically underserved and marginalized. So quickly, so we just all have a baseline, what does health disparities mean? When you use that term, Marie, what are you talking about? Well, I'll use the CDC definition for you. It's preventable differences in the burden of disease, injury, violence, or opportunity to achieve optimal health that are experienced by populations who are socially disadvantaged. Now, a subset of health disparities is pharmacotherapeutic disparities. And again, while I was department head here, Elizabeth Hall Lipsy and I collaborated on this study, and I think we coined the term pharmacotherapeutic disparities. I remember when we were in the office, we're going to call it this and see what happens, right? And this is defined as disparities related to or caused by desperate treatment with medications. In our study, we conducted a literature review of all these research articles that kept on growing and growing and growing, and Elizabeth remembers that and probably our pain with that. But what we did was address the influence of race, ethnicity, and sex on drug treatment. Now, before I get into the study itself, let's just address the question, why do pharmacotherapeutic disparities matter? Why do we care about it? Well, we use a lot of drugs in this country. We use a lot of prescription medications. That's something we can measure. And you can look at this slide over the last 2 decades that's grown, and it will continue to grow as we treat human conditions with medications. And so we're going to see this increase and increase and increase. So getting back to the study, this is what we found. This is the take-home message. It was not my intent to make this too deep of a scientific talk today, but we looked at 240 articles that addressed the issue that actually found out of all of the 311 articles that we included in the study that noted significant disparities in drug treatment affecting racial and ethnic underserved groups and females. Now, most of these disparities, more specifically, they involved receiving fewer prescription medications. They were less likely to be prescribed the appropriate drug therapy. They received less effective dosages, and they had to wait a longer time to actually receive the medications. Now, all of this equaled bad outcomes in a nutshell: increased hospitalizations, decreased survival rates, and decreased achievement of therapeutic goals. Now, I will tell you that this was the first article of its type to look at all of these disparities at one time. But that really isn't the message that I want you to leave here with today. It's this message right here. And we set this back in 2010. And so, I don't know, your kid should be going on 13, 14, something like that. Yeah, there you go. We said this. We said disparities will continue to grow without adequate attention and resources to reduce and eliminate them. And we saw this. We continue to see this. The most recent reminder in my head is the pandemic and all of the things that came out of the pandemic and the awareness for some of us. And then for some of us who knew it all along, what are we going to do about it? So as part of my own efforts to reduce health disparities and make progress toward health equity, one particular passion of mine is the Medication Access Program, or MAP. And as I said earlier, I did this as a faculty member. I was a transplant pharmacist at the Medical College of Georgia at that time. And what I noticed, many of my transplant recipients were often non-adherent to their medications. So you got to sit back and think about this. And I was in kidney transplant at the time. You have a person who was on the waiting list for kidney maybe 4 or 5 years. They get this new lease on life, and they stop taking their immunosuppressive agents, and they're getting ready to reject this kidney. And so I had to scratch my head because I know nobody gets up and say, I'm going to be non-adherent today. You know, that's not a goal for most patients. And so I wanted to understand this more. And this is what I quickly learned, that a large number of these patients were from underserved populations, and they simply just could not afford their very expensive prescription medications. And I submit to you, when you're taking this many medications per day, and that's what the transplant patients take, not only is it cumbersome, but it's also expensive. Commonly $40,000, $50,000 regimens, day in and day out. And that's the annual cost. So that's a lot. That's a lot, even for many of us that have six-figure incomes, right? And so you could imagine that burden that we're putting on certain patients. So to improve access, I created MAP, whose mission is to increase access to prescription medications for solid organ transplant recipients. Now, since its inception, and it started in 1999, so I'm really dating myself here, MAP has helped approximately 1,100 transplant recipients receive more than $112 million in medications. Now, my colleagues and I, over the years, we have published on MAP a great many times, but I will share with you this article for the sake of time today, which further documents MAP's impact. So in addition to significantly increasing medications and access to medications for individuals, patients enrolled in MAP experience significant decreases in blood pressure, decreases in blood glucose, total cholesterol levels, as well as LDL levels. And we also saw a decrease in acute graft rejections and an improvement in their quality of life. Another passion of mine is addressing education inequities and increasing the diversity of the healthcare workforce. And many of us in here, our job is at the nexus of educating tomorrow's healthcare professionals. And why is it important that we have a diverse healthcare workforce? Well, I'll point to the Institute of Medicine. And they talked about the benefits of increasing diversity a long time ago. And they talked about this diversity as helping to have greater patient access to care, improving patient satisfaction, better patient-provider communication, and improve educational experiences for health professional students. All of this leads to improved healthcare for all. Now, to demonstrate diversity in the healthcare workforce, or I should say lack thereof, I want to share with you a quick study that was published in 2021, and it used race and ethnicity as proxies for diversity. And this study found, by using 2019 data, so not too long ago, that Black individuals comprise approximately 12%, and Hispanic individuals comprise roughly 18% of the general US workforce. And what you clearly can see in these graphs, and this is of Black healthcare workers, this is Hispanic healthcare workers, and you have 10 different disciplines of healthcare listed. What you clearly could see is that Black and Hispanic healthcare workers are underrepresented in each of the 10 listed healthcare fields. There's pharmacists right there, okay, dentists, okay, and physicians. All of them, though, you see that there's a gap. And so we definitely have more work to do and more opportunities to seize. I'm not sure if Nancy is there in Phoenix, but if she is, we promised to get together and talk about strategies.
I'm here.
To Great, Nancy. Remember when we were at ASHP, we were at somebody's reception because I tried to hit them all. And I saw you there. We talked about strategies to help with this. And so let's talk about strategies to improve workforce diversity. I think that we must articulate the importance of diversity in our institutions and the communities we serve. And this not only goes for healthcare diversity, but any type of diversity, whether you're talking about faculty or students across the board. We must actively recruit, develop, and support students to get on pathways to careers in healthcare and support individuals in the workforce from diverse backgrounds. And I still have my form camp t-shirt. I wear it around, the blue t-shirt with a big A in the front of it. So, and I know we have some students that were here at U of A, and they started out at farm camp. Providing programming to reduce unconscious bias is very important. We have to be deliberate in expanding opportunities to diverse individuals. If we're not deliberate, and I just shudder to think about some of the rulings that's going to come along with the Supreme Court deliberating on some things. We have to promote mentorship and sponsorship. And we have to have supportive learning and work environments where all can grow, develop, and be successful. And we also have to go beyond diversity to address equity inclusion, and belonging. Now, all of these strategies are important not only to build a diverse student body and workforce, but also to build success for learners and employees, like I said, from all different dimensions. So let's take a moment now to think about building bridges. I mentioned earlier that building bridges in health professions, education, and in healthcare is one of my passions. But what do I mean exactly when I say, let's be a bridge builder? It means that your goal is to support others and help them advance in their dreams and making their dreams become reality. And this could be the dreams of your classmates, your colleagues, your patients, um, your instructors, your neighbors, everyone and anyone. And so to close my presentation today, I would like to briefly share with you one of my favorite poems that I actually first came about when I was here at the University of Arizona. So it's so fitting that I recite this poem for you today here, and it's entitled The Bridge Builder. And you have a copy of that on that handout that Dr. Tung passed out. An old man going along highway came at an evening cold and gray to a chasm vast and deep and wide, through which was flowing a sullen tide. The old man crossed in the twilight dim. The sullen stream had no fear for him, but he turned when safe on the other side and built a bridge to span the tide. "Oh man," said a fellow pilgrim near, "you're wasting your strength with building here. Your journey will end with the ending day. You never again will pass this way. You crossed that chasm deep and wide. Why build this bridge at evening tide?" The builder lifted his old gray head. "Good friend, in the path I come," he said, "there followeth after me today a youth whose feet must pass this way. This chasm that has been naught to me, to that youth may a pitfall be. He too must cross in the twilight dim. Good friend, I am building this bridge for him." So thank you for your time and attention. Thank you for inviting me here today. Thank you for your continued friendship and our support of each other. It continues to grow. And let's together continue to build bridges. Thank you so much.